I'm a nursing student from the University of Detroit, Mercy, and I'll be doing a brief physical assessment on you today. Is that okay? Yes. Okay. Let me just wash my hands. Before we get started, are you allergic to any medications or latex?
No.
Okay. And can you verify your name and birthday for me?
Kimberly Brigman, October 23rd, 1992.
Okay. And do you know where you are today?
Detroit, Mercy.
Do you know the date?
December 4th, 2012.
Okay. And are you in any pain today?
No.
Alright, so the patient appears her stated age of 20. She is alert and oriented times 3. She has no offensive body or breath odor. She shows no obvious signs of illness, and she's not in any pain. Okay, so I'm just going to palpate your skin. Okay, so the skin is warm and dry. Can I just check out your eyes? You stare straight at me. Okay, so the pupils are equal, round, and react to light. And can you look straight at the pen light? And they have consensus, convergence, and accommodation, which is cranial nerve 3 and 4. Can you look up? I'm going to check your conjunctiva. Okay, the conjunctiva is pink. Can you open your mouth for me? The buccal mucosa is pink and moist. No lesions. She has no missing teeth. The tongue is midline with no coating. She does not have a uvula. Her tonsils are about a 1 plus. Can you say ah?
Ah.
Okay. Alright, thank you. And that was checking for the gag reflex and saying I was cranial nerves 9 and 10. And can you stick out your tongue for me? And that was cranial nerve 12. Okay, so now I'm going to, palpate your carotid arteries. Okay, that one's about a 2 plus. And this one's about a 2 plus, and they're equal bilaterally. And I'm going to auscultate for bruits with the bell of the stethoscope. Can you breathe in, breathe out, and hold it? Okay, no bruits present. Can you breathe in, breathe out, and hold it again? Okay, no bruits present. One more thing on your face that I want to do. Can you smile for me? Can you puff your cheeks? Okay, that was cranial nerve 7. I'm going to listen to your heart sounds. Wait, before I do that, let me palpate your skin. I'm going to check the brachial plexus. There are 2 plus equal bilaterally. And check the radial plexus. And there are 2 plus equal bilaterally. I'm going to check your hands. Check capillary refill. Okay, so the capillary refill was instant within 1 to 2 seconds. And she has no clubbing on her hands, no lesions. Now I'm going to check your heart sounds. Sorry. Okay. The right second intercostal space is where you hear aortic. The second left intercostal space is where you hear pulmonic. The third left intercostal space is where you hear herbs, and S2 is best heard at the base. The fourth left intercostal space is where you hear tricuspid. The fifth left intercostal space, which is also the midclavicular line, is where you hear the apical rate, and you'll count that for 60 seconds. Okay. Now I'm going to check for lung sounds. I'm going to check in 10 spots. When I move the stethoscope, I want you to breathe in and breathe out. So this is 1, 2, 3, 4, 5, 6, 7, 8, and laterally 9 and 10. Could you turn around for me? I'm going to check the back, your posterior for lung sounds. And I'm just going to move your hair over. So I want you to breathe in and breathe out every time I move the stethoscope. 1, 2, 3, 4, 5, 6, 7, 8, And I'm going to do laterally 9 and 10. Now I'm going to check her spine for curvature. And her spine is straight, no kyphosis or scoliosis. And I'm going to do the CVA check. Can you let me know if you have any tenderness?
No.
No. Okay. Can you lay on your back for me? Do you have it to empty your bladder?
No.
Okay. I'm just going to do a check of your abdomen. Sorry. I'm going to pull your shirt up for a second. So first I'm going to inspect the abdomen. The abdomen is flat. The color is appropriate for her ethnicity. She does have 2 scars from a bone grafting that she had done. It's no lesions. Everything looks good. I'm going to begin auscultating in the right lower quadrant first with the stethoscope. And this is where the appendix is. Then I'll do the right upper quadrant where the liver is. The left upper quadrant where the spleen is. And the left lower quadrant where the sigmoid colon is. Okay, so vowel sounds are present in all 4 quadrants. And now I'll percuss, starting in the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. Okay, and now I'm going to do light palpations, starting with the right lower quadrant, the right upper quadrant, the left upper quadrant, the left lower quadrant. Did you have any tenderness?
No.
Okay. I'm sorry, let me cover you up. Now I'm gonna palpate her skin for warm. And the skin is warm and dry. Put your leggings. And check for edema. No edema is present. Okay? And I'm also gonna do your posterior popliteal pulse. Okay, so the popliteal pulse is by the 2+, equal bilaterally. And can I take off your socks?
Yeah.
Okay. Let me do the posterior tibial pulse. And these are 2+ equal bilaterally. The dorsalis pedis pulse. That's a 2+ equal bilaterally. Oh, I'm sorry, that's a 2+. And this one is a 2+, so they're equal bilaterally. And I'm going to check her toes for clubbing. There's no clubbing. And capillary refill. Okay, so the capillary refills instantly. And now I'm going to do the Babinski test. So I'm going to take the pen light and I'm going to move it from the ball of the heel, making the upside down J. Okay, and that was a negative Babinski test. You want to put your socks back on? And before I have you get off the bed, can you scoot forward for me? And I forgot to do the hand grasp, so I'm going to do it now. Don't let me pull you up. Okay, so the patient is strong and it's equal bilateral. Okay, can you stand up, put your feet together, and your hands to the side. And I'm just going to check for swaying. Can you close your eyes for me? This is the Romberg test. I'm going to do this for 20 seconds, checking for swaying. Excessive swaying. And the patient does not sway excessively. Okay, now I'm going to do the get up and go test. Can you walk straight for me? Okay, stop and turn around. And can you walk heel to toe? Okay, that's the end of my assessment.